Artificial Intelligence Dr. www.abcpharma.net/English. How long is the recovery after implanting an Aveir VR leadless pacemaker? Cohere AI. The recovery time after implanting an Aveir VR leadless pacemaker can vary depending on several factors, including the patient's overall health, the specific procedure performed, and their individual rate of healing. Here's a general overview of the recovery process and timeline. Immediate post-implantation recovery. Most patients can expect to stay in the hospital for 1 to 2 days after the Aveir VR implantation. During this time, healthcare professionals will monitor the patient's heart rate, rhythm, and overall recovery. The implantation site, typically in the upper leg where the catheter was inserted, will be dressed with a bandage, and the patient will be instructed on how to care for it to prevent infection. Patients may experience some soreness or discomfort around the implantation site, which can usually be managed with over-the-counter pain medications. Activity will be gradually increased during the hospital stay, starting with light walking and progressing as tolerated. First few weeks after discharge. During the first few weeks after discharge, patients can generally resume light daily activities and self-care tasks. It's important to avoid strenuous activities, heavy lifting, or vigorous exercise during this initial recovery period. Walking and light household chores are usually safe and encouraged. Patients should follow the doctor's instructions regarding wound care and keeping the implantation site clean and dry. Any specific restrictions or recommendations regarding bathing, showering, or swimming will be provided by the healthcare team. Follow-up appointments will be scheduled to assess the patient's recovery, check the pacemaker's functioning, and adjust the pacing parameters as needed. Subsequent months. Over the subsequent months, patients can typically resume most normal activities, including moderate exercise and light sports, as tolerated. It's important to continue following the doctor's advice and attend regular follow-up appointments to ensure the pacemaker is functioning optimally and the pacing parameters are adjusted as necessary. Patients should be aware of any signs or symptoms that may indicate a problem with the pacemaker, such as persistent discomfort at the implantation site, unusual heart rhythms, or unexpected device alarms. Long-term recovery. The recovery process is generally complete within a few months after the Aveir VR implantation. Patients can expect to resume their usual activities, including work, hobbies, and most forms of exercise, unless otherwise advised by their doctor. Regular follow-up appointments will continue to monitor the pacemaker's functioning and battery life, and to address any concerns or adjustments that may be needed over time. Remember, the above timeline is a general guideline, and individual recovery experiences may vary. It's important for patients to closely follow the instructions provided by their healthcare team to ensure a safe and successful recovery.